If you have numbness in your little finger, it may not stop you from doing a lot of things, but it sure is annoying, and you'd probably like to find out what's causing it and how you can get it to go away. Hi, I'm Dr. Dave Candy, and in this video, I'll explain what causes numbness in the little finger and ring finger and how you can get it to go away. Now, your little finger and part of your ring finger are innervated by a nerve called the ulnar nerve. The ulnar nerve starts out in the lower part of your neck, runs down through the shoulder region, and then comes down the inner arm on the inside of the elbow, through the wrist, and then goes into your little finger and part of your ring finger. So there are multiple different places where the ulnar nerve can get entrapped or irritated. So first I'm going to go through where those various places are, and then some tips that you can use to take pressure off depending on where the nerve is entrapped. So the ulnar nerve starts out primarily in the C8 and T1 nerve roots in the lower part of your neck. That comes out right at the base of your neck, where many people have a little bit of a bump where the thoracic spine transitions into the neck. The C8 nerve root is right at the lowest part of the neck, right below the C7 vertebrae, because there really is no C8 vertebrae. And then the T1 is just below that. Those two nerves then form the lower trunk of the brachial plexus. The brachial plexus is a big bundle of nerves that passes through the shoulder here, and it runs underneath of your collarbone and over top of your first rib. There are also some muscles that attach from your neck to your first rib called the scalene muscles, and the brachial plexus runs through there. Then the brachial plexus runs underneath your pectoralis minor muscle right here before coming into the arm. And then it branches out into its branches, one of which is the ulnar nerve. Now this area in through the neck, collarbone, chest is referred to as the thoracic outlet. And there are multiple different places in that area where the nerve can get entrapped. The next spot where it can get entrapped is down at the elbow, in a little bump down here known as the cubital tunnel. It's right between the bump on the tip of your elbow, called the olecranon process, and this bump on the inside of the elbow. The nerve passes right through this soft spot and is colloquially known as your funny bone. So when you hit your funny bone, you're really zinging your ulnar nerve. And then the next place it goes is down through the inside of the arm and through a little tunnel in your wrist called the tunnel of Guyon. That's made up of a little ligament from the hook of the hamate to your pisiform bone, which are two bones in your hand. Now, the ulnar nerve can get irritated in the tunnel of Guyon from putting a lot of pressure on this area of your hand. For example, riding a bike for long distance with a lot of pressure on the handlebars. It can also come from driving a lot. For example, if you drive a car or truck or van for a living and you always have your hand resting on the steering wheel, that can also put pressure on the ulnar nerve. Now, if you have an ulnar nerve entrapment at the hand, there aren't necessarily a lot of exercises for that. It's just paying attention to not putting so much pressure on that area. Additionally, if you use a mouse and your hand is always resting on that area, that's another way that you can entrap the ulnar nerve. So making sure not to put too much pressure on this area of your hand is one way to relieve numbness in your little finger, if it's coming from the hand. But let's start back up at the top, because neck problems are probably the most common cause of numbness and tingling in the little finger or ring finger. A problem with typically the C8 nerve coming out of your neck. Now, as you age, you lose space between your vertebrae, and one of the most common reasons why people will pinch the C8 nerve in their neck is from having decreased space between their vertebrae from degenerative disc disease, often along with posture issues from sitting with a forward head posture like that. Furthermore, tipping your head to the affected side further narrows the spaces where the nerves come out of your neck. So if you're in the habit of holding your phone between your ear and your shoulder, that can narrow the nerve spaces in your neck. And you also want to make sure that you're just holding your head in a midline position. If you're sleeping at night, you don't want to have so low of a pillow that your head's hanging down to the side. You want to try to keep your neck in a neutral position. Additionally, stretches where you tip your neck away from the affected side can help open up the spaces where the nerves come out of the neck. However, that also puts tension on your scalene muscles. And if you have a pinched nerve in your thoracic outlet, stretching like that pulls the first rib up through tension in the scalenes and compresses the brachial plexus between the first rib and the collarbone. So there's a little modification that's often helpful to make before stretching your neck away from the affected side. To do that, you'll take a long belt or dog leash or a stretching strap like this one and sit on one end of it. So you'll lift your bottom up and put one end of the strap underneath your bottom. Then you take the other end of the strap or towel or dog leash and pull it across your shoulder like this. You want this hitting as close to your neck as possible. You don't want it out on the shoulder blade, because if you're pulling it down on the tip of the shoulder, that pulls your shoulder blade and collarbone down. And when your collarbone comes down, that again can further compress on the brachial plexus. So you want to make sure that this strap is hitting close to your neck. Pull down, put pressure on that first rib, and then do just a very gentle tipping of your head away from the affected side. You should feel the stretch up in this area up here, above where the strap is hitting. And that helps open up the spaces in the neck where the nerve roots come out, as well as holding your first rib down so that you don't pull the first rib up into the brachial plexus when you're stretching. Additionally, I mentioned that if your collarbone is pulled down, that can also put some pressure on your brachial plexus and contribute to little finger numbness. So it is a good idea to get proper arm support, sitting with arm rests if you're working at a desk or sitting on a couch, or using a pillow underneath that arm if you don't have access to arm rests. Furthermore, it is a pretty common pattern to see where people who have little finger numbness, they'll have a shoulder that's depressed on that side and a first rib that's elevated. Often that comes from a slight curvature in the spine, where your thoracic spine is curved over that way. And because we don't like looking at the world sideways, we tip the head up to be vertical, and that puts tension on the scalenes, which then pull the first rib up. So the next exercise I'll show you is to correct for that posture by reaching your arm up in the air. This helps elevate the shoulder blade and the collarbone. Reach up as high as you can go, and then also tip just slightly over to the side. So that side bends the trunk away from this side a little bit and helps if you have a thoracic scoliosis where you're tipped over slightly to that side, as well as help stretch the lat muscles which pull your shoulder blade down. The next place that the nerves that make up your ulnar nerve can get pinched is as the brachial plexus passes underneath your chest here. You've got a muscle in your chest called the pec minor. It runs from your ribs and sternum to a little hook on the front of your shoulder blade. So if you sit with rounded shoulder posture like that during the day, it tightens your chest muscles. And so paying attention to sitting with your shoulders up and slightly pulled backwards can help to stretch out the pec minor. Now that's not necessarily squeezing your shoulder blades back together like that. It's more lifting your chest upwards. Now there's an exercise that you can do to help out with this as well, and that's just putting your arms up like a goalpost, like this, thinking about rotating your hands backwards and then reaching up as far as you can that way. You can do that sitting down, or you can also do it standing with your back up against a wall to make sure you're keeping your back flat. But the important thing is that you're lifting your chest, pulling your shoulder blades back, and externally rotating your arms. Now this does put you in a little bit of an ulnar tension position. And the tension position of the ulnar nerve is actually up like this, with your elbow bent so that the nerve wraps around your cubital tunnel and then comes up into the little fingers. So as you're doing this exercise, if you notice that your hands are going numb or your little finger is getting tingly, then take a break, rest for a little bit, and then return back to that stretching position like this. So those were the thoracic outlet exercises that you can do if you have numbness or tingling in your little finger. Now, those were all for the nerve roots and the brachial plexus before it actually branches off into the ulnar nerve proper. Once that ulnar nerve branches off the brachial plexus, it runs down the inner side of the arm here and goes through the cubital tunnel. Now, you can irritate the nerve at the cubital tunnel by bumping your elbow, like hitting your funny bone, but you can also irritate it if you have repeated or sustained positions of end range elbow flexion. That tensions the ulnar nerve across the cubital tunnel. So the best tip for that is just avoid those end range elbow positions. Try to stay a little more straight to mid range without going all the way up into end range elbow flexion. Now, after you've stretched out all the areas where the ulnar nerve can possibly be pinched or compressed, it's time to start moving the nerve using what's called a nerve glide. The tension position for the ulnar nerve, like I mentioned before, is up like this, kind of like you're carrying a tray. So this would be the tension position, and then you want to take pressure off of the nerve by coming down into this position down here. So you're going to go up this way, like you're carrying a tray, and then come down that way to take tension off the nerve. And just move back and forth through these positions. Now, if you've got a really irritable ulnar nerve and you can't get all the way up into this tension position comfortably, just go through the part of the range that you can comfortably. And as your nerves get less irritable, you'll be able to go farther and farther into the tension position. But nerves are very irritable tissues, meaning when you make them angry, they tend to stay angry. They don't calm down right away all the time. So it's important not to push into pain when you're doing nerve glides. Now, I know that was a lot of information that I threw at you in a very short period of time. So I just want to briefly summarize that your ulnar nerve is made from the C8 and T1 nerve roots in your neck. It then passes down through your collarbone and first rib area, through the chest, down through the inside of the elbow, and into the little finger and the hand. You want to sit with proper posture with your chin down and good arm support to help take pressure off the nerve at the neck and shoulder region. You also want to do exercises to open up the spaces where the nerves come out of the neck, probably using a strap or a towel over top of your first rib to hold the first rib down. Additionally, raising your arm up in the air to raise your collarbone and leaning to the opposite side to help if you have a little scoliosis can be helpful. You also want to stretch your chest muscles by raising your chest, arms up like a goalpost, and just holding this position for 30 seconds to a minute if you can without causing further numbness in your fingers. You want to avoid end range elbow flexion, which can put pressure on the ulnar nerve at the cubital tunnel, and also leaning on this area of your hand, which can put pressure on the ulnar nerve at the tunnel of Guyon. And then finally, once you've done all those things, gliding your nerve using an ulnar nerve glide by going up in a position like you're carrying a tray, out to this position, and then just moving back and forth intermittently throughout the day can help get movement and blood flow to the nerves. So hopefully you did find this video helpful. If you need some more resources to help out with numbness or tingling in your little finger, check out this video on thoracic outlet syndrome or this video on cubital tunnel syndrome. But before you go check those out, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.